Well, the genetic testing for prostate cancer patients is really, it could have a broad impact, both understanding who needs to be screened and who might benefit from screening. Right now, when we just obtain a family history, many times we don't even know what our parents had, or certainly what our grandparents had, depending on the generational details of what our parents and older people often didn't really share their health problems. So when we take a family history, many current people don't really know their family history in great detail. Some do, but many don't. And if you have a strong family history of prostate cancer, of course it influences your risk of prostate cancer, and it may influence the risk of your children. And then the other thing that we're coming to realize is that the genomic risk that might be inherited in your germline, that means from your parents, could influence the kind of prostate cancer you have and how sensitive that prostate cancer is to various therapies. So for instance, the famous BRCA mutation that of course increases patients' affected families' risk of breast and ovarian cancer particularly, also increases the risk of prostate cancer, but it also changes the response of those patients. They tend to have worse prostate cancer that doesn't respond as well to conventional therapies. And there's emerging evidence that some particular therapies, like PARP inhibitors, might be better in a BRCA2 patient with advanced disease. So all this data has really emerged just in the past couple of years. So I think genomics is going to be important for screening to determine perhaps who should get PSA testing, and maybe at the other end of the spectrum, for someone who's at very low risk of prostate cancer, we might be able to determine that based on single nucleotide polymorphism testing. Maybe they could have less screening because they're at kind of the low risk of the spectrum.